This week's case study is a great case study. I mean, they're all great, but this one's especially good because this patient, when he came in, he had a severe neck problem and a severe low back problem, and we treat the neck and the low back. And he's a 55-year-old male who in 1978 had a whiplash. His car was hit from behind and he had a whiplash. Now, with a whiplash, very often if you're sitting in your car and you're hit from behind, and this is the 70s, so probably wasn't wearing a seatbelt, but when you're hit from behind, you kind of go like this. And when your spine does that, what happens is all the soft tissue gets torn that holds the spine together, which ultimately leads to problems in the future. So he'd had a car accident in 1978, and he'd had back pain and neck pain that sort of plagued him for the next 35 years. Now, during that time, he had tried medicine, he did narcotics, he did the anti-inflammatories, he did muscle relaxers, and he took a lot of ibuprofen, and it actually got to the point where the ibuprofen had caused a bleeding ulcer in his intestines, and he was admitted to the hospital because of these bleeding ulcers, and it got to be a very severe problem. So he tried the medication, found some relief, but ultimately caused him more trouble in the future. Also during that time, he had seen chiropractors, and most recently, for the last 15 years, he had seen the same chiropractor, and during his chiropractic visits, he would have these episodes of back pain, and he'd get treatment and he'd feel better. But most recently what had happened is he had this severe back pain, and he was getting treatment and he wasn't getting better. And also during that time, he had tried physical therapy, did a couple of episodes of physical therapy, felt a little bit better, but the problem never really went away, and very often what happened is the problem would come back and it come back worse. Same thing with shots. He had done some epidural shots in his neck to help alleviate some of the problems in his neck, and he felt better for a while, but most recently he started feeling worse, worse than even before the shots. So he had seen a surgeon. He had seen a surgeon for his neck, and the surgeon wanted to do a surgery on his neck, and what they wanted to do was an anterior fusion surgery. He didn't have it, he chose not to have it, but with an anterior fusion surgery, what they do is they put a metal rod, they go through the front, and then they put metal rods and screws, and they screw it right into the body of the vertebrae to hold everything together. It's a complicated surgery. Certainly any fusion is a complicated surgery, but in this case, when you have to go through the front, there's a lot of things in there you got to be real careful with, so it tends to be a very complicated surgery. He chose not to have the surgery, and he was kind of living with the discomfort. But more importantly, what had happened is he couldn't turn his head to the left, and he was getting numbness into his arms, pain and numbness into his arms, which is the pinched nerve in his neck. So he had a pinched nerve in his neck. It's kind of hard to see, but this is the top view of the disc, and here's the spinal cord, and the disc was pushing into the area where the spinal nerve was, which is right there, which is really the result of changes in the disc. Most importantly, right in here where the disc is pushing into the spinal canal. Okay, one vertebrae on top of the other with the disc in between. You can see this is the disc pushing into the spinal canal, but also because he had the whiplash, the normal curve that should be in the spine is now sort of curving the wrong direction. A curve which is normal for the neck is called lordosis. He tends to have a little bit of a kyphosis, and anytime your spine goes further from normal, away from the lordosis, it'll start to load the discs, and the loading of the discs over time ultimately is what caused him to have this herniated disc. So he's got a herniated disc in his neck, and then he started having some trouble in his low back. And when he had the trouble in his low back, ultimately the same thing happened. He had some herniations. Just real quick, this is what a normal curve should look like in the neck. Okay, you can see that compared to the other one, but right now we're talking about his low back. So when he came in with his low back, he also had two herniated discs. And the two herniated discs, one of them, the disc, the nucleus had pushed all the way out into his spinal canal, and he was having a great deal of problems in his back. But he was also at a point where he was stuck in a forward flex position because this herniated disc was compromising the nerve and he couldn't straighten up. So in that flexed position, he was increasing the load on his disc. Obviously, it was causing him a great deal of trouble both at home and at work. Couldn't turn his head, couldn't stand up straight, so he's having lots and lots and lots of trouble. Now, he was definitely on a path to surgery before he came in to see us. He was referred by his son, thankfully, and when he came in right away, within about 3 treatments, he started to feel better. Now, when a patient comes in, we evaluate their movement, so we identify how well they can move, but also, more importantly, we use 2 variables to address how well we're doing with our therapy. Number one is pain. Everybody comes in because they have pain, but also we have another one called the Disability Index. The Oswestry Disability Index, ODI, is a number that we use to identify how stable or how unstable your spine is, or what effect the pain has on your life. So we have a score. It's scored between 0 and 100. The closer you get to 100, the more disabled you are. Actually, anything above, really above 80 is considered a severe disability where you're unable to get out of bed. So it falls into 5 categories: 0 to 20, 20 to 40, 40 to 60, 60 to 80, and 80 to 100. And anything above 40 really is considered a severe disability. Okay, so our goal when patients come in is to get their scores lower. So when he first came in, his neck index was a 42, which is considered a severe disability, and his low back was a 52. So both those categories put him in the range of surgery. Anywhere between 35 and above is really the range of surgery. So when he came in, he was kind of on a tightrope. It was a very challenging condition with, leading down a path to ultimately surgery. So he came in looking for options to avoid the surgery, and after 12 treatments, we were able to get him from a 42 in his neck down to a 28, and then his low back, we got him down from a 52 down to a 30. Now, the zone that we look for, the safe zone, is anything below 20. So our ultimate goal is to get him below 20. And as we went through more therapy with his low back, we were able to get him from a 30 down to an 18, and his neck from a 28 down to a 24. Now, one of the problems with his neck was he had that reverse cervical curve. And anytime you have a reverse cervical curve, it just takes a little bit longer. He's still currently in our care, and he's getting better. Now, I know he's pain-free. He has a little bit of stiffness, and he's able to do more with his life, but ultimately, he's back to a point now where he's able to live pain-free. He has some stiffness and maybe a little discomfort once in a while, but 90% he's feeling great. And I know most recently he was able to move furniture. Now, I don't think moving furniture is the best thing for your spine, especially when you were a surgical candidate 3 months ago. But he's feeling better, he's able to live his life, and he's doing a lot of things that maybe he wouldn't have normally done. That's our case study. Thank you very much. If you have any questions, or you have a problem that's not getting better, you give us a call. The phone number should be on here, and give us a call. Thank you.